Well, there are two problems you get into with COPD and the acute exacerbation. One is you don't get enough oxygen into the blood, and the only way to really treat that is to administer oxygen. And the second problem is that some of these people cannot breathe enough, and therefore their carbon dioxide levels in the blood go up, which has adverse consequences to it. And the only way to fix that is to help them breathe, and that's what non-invasive ventilation does. It helps them breathe. So you're dealing with both problems, the low oxygen and the high carbon dioxide, when you combine these therapies. Well, the HOT-HMV study basically took patients after they had acute exacerbation of their chronic obstructive pulmonary disease. They managed them as they will in the hospital, and then they sent them home. If they came back in and still had elevated carbon dioxide levels, which is an indication of what we call respiratory failure, inability to breathe, they then randomized them to either putting them on a non-invasive ventilation device or not. And then they looked at how long it took for them to either exacerbate again and be hospitalized or actually die as a result of their COPD. And they compared the two arms, and as it turned out, the arm that had the non-invasive ventilation did substantially better, in that they required quite a bit longer before they had to come back into the hospital than the group that was only receiving oxygen. Well, the recent analysis was to look and say, is this management of patients cost effective? And so they basically went back and looked at the cost of all things related to the care of the patients, which means medications, doctor visits, medical equipment, hospitalizations, and everything. And they compared the two groups. And they did two analyses. One was on a UK model in terms of what things cost there, and the other one was in the United States in terms of what things cost here. And in the United States analysis, they found that they actually saved money, meaning it costs less to take care of these patients if you put them on the non-invasive ventilation than if you did not. And that's interesting because non-invasive ventilation devices are not that inexpensive. So not only did you get them on this, which improved their outcomes, but you saved money. So that's sort of a home run. In the UK system, they did not save money. It cost a little bit more to manage them on the non-invasive ventilation, but it fell within the range of what is considered cost-effective medicine, well within the range. And so in the United States, we actually saved money and got better outcomes. In the UK, it cost a little bit, but the outcomes were still good and well within the range of what's considered cost-effective medicine. Right now, I don't think there are other studies planned. I think we know the primary outcomes, we know the cost effectiveness, so there's not a formal plan for other analyses right now. There are other studies that could be done, like this study did not do a careful analysis of how much time you use the NIV device and did that predict outcomes. They only followed them up for 1 year, and they could have followed them up for longer to look at survival and things like that, but there is not a plan right now on the books for further analyses or data collection.